Today on PGTV News, Governor Ron DeSantis is offering a choice to school districts that may not want to open school doors this fall. What that might mean to your student, that's coming up. And the world's largest retailer is not going to let Black Friday fall on Thanksgiving Thursday. Find out why. All that and more is ahead on PGTV News. Welcome to PGTV News. I'm Steve Barnes. Tina Mann is out on vacation. As Florida continues to see an increase in coronavirus cases, the state's largest teachers union is suing Governor Ron DeSantis' administration over plans to reopen schools for in-person instruction next month. In its lawsuit filed in Miami State Circuit Court, the Florida Education Association said the school reopening order violates the Florida Constitution, which requires that a uniform, efficient, safe, secure, and high-quality system of public schools exists. Joining the FEA in the lawsuit are several teachers, along with the NAACP state chapter and its national organization. Defendants are DeSantis, Education Commissioner Richard Corcoran, and Miami-Dade County Mayor Carlos Jimenez. The union says that decisions about the reopening of schools, whether in person, online, or a hybrid system, should be made at the local level. The governor, though, again tried to distance himself from the back-to-school order, pointing out, "I didn't do an executive order. That was the Department of Education." He also said that for parents and students, choice is paramount when it comes to the type of classroom that will reopen next month. DeSantis said last week and acknowledged that the state hadn't moved forward with any kind of protocols for on-campus testing, isolating of students and teachers who test positive for the virus, or how to manage the possibility of quarantining an entire classroom or school. The governor repeated that there were liabilities to online learning for many students. Well, since the filing of the lawsuit, Governor Ron DeSantis has offered a message to give families and teachers the choice to return to classrooms in August as COVID-19 cases continue to surge. DeSantis said Florida's 67 school districts should have the option to delay the start of school a few weeks and should not force teachers and parents to return to school if they have underlying medical conditions or if they just don't feel comfortable with in-person instruction. The governor did not mention the controversial state order that said school districts must reopen brick-and-mortar schools at least 5 days a week starting in August unless local and state health officials say otherwise. While the risks to students from in-person learning are low, the cost of keeping schools closed are enormous, DeSantis said. Let's be honest, distance learning is a far cry from in-person instruction, and it places a tremendous burden on our working parents. A major part of the controversy about reopening the schools involves risks to teachers and other school employees, particularly those who are older or have medical conditions that make them vulnerable to the contagious and deadly respiratory disease. DeSantis stressed that if educators and other employees do not feel comfortable going back to schools, they should not be forced to do so. Amid rising numbers of COVID-19 cases across the state, the Florida High School Athletic Association Board of Directors rejected a plan to push back the start date for fall sports. At the end of a nearly 5-hour meeting, the board voted to maintain the current calendar for fall sports, but offer flexibility to allow the local school districts or schools to start when they see fit. That decision came after a task force produced a plan that would have pushed back the start date for fall sports, and the Sports Medicine Advisory Committee recommended changes to the fall calendar. The board meeting was viewed by nearly 4,000 people on YouTube or Zoom. The move, however, goes against recommendations by the FHSAA's Sports Medicine Advisory Committee, which had met the week before. Well, Florida Southern College has released a detailed plan for the resumption of classes on campus starting September 1st. Here's President Ann Kerr with some of those details.
Good morning. I'm Ann Kerr, President of Florida Southern College, and we are here getting ready to welcome students back to campus. This will be a very different semester for us, the most unique in the long and storied history of Florida Southern College. We have many procedures designed to keep our community as safe as possible, so I encourage you to go to the website and look at FSC Cares to see all of the guidelines that will guide us in this new environment where we find ourselves. This plan was created by faculty, staff, the administrative team, in consultation with medical experts at Lakeland Regional Health, who is the manager of our college health center, as well as medical experts at Watson Clinic, Center for Disease Control advisors who are working with colleges and universities, and a host of other advisors who are helping us review and attend to every aspect of this plan. Please be aware that some aspects of the plan may change as we draw closer to our opening date. Our experts are reacting to this almost on a daily basis, and we are meeting on a daily basis to ensure that every detail that we can possibly cover is taken care of to ensure your safety. I will share that each and every person in our Florida Southern College community has a responsibility to follow these guidelines and to accept responsibility for trying to keep yourself safe, as well as the rest of us who will be interacting with you, teaching you, and ensuring that you have a world-class living learning experience at Florida Southern. The most important aspect of this plan is that its success is dependent upon each of us following the guidelines, wearing the mask, taking care of social distancing, understanding and being patient. I want to pause for a minute and give a great big thank you to all of our graduates who are serving as nurses, physician's assistants, doctors, all of our graduates who are in the healthcare professions. I've heard from so many how they have been treated by Florida Southern College graduates and the level of health care they're providing. So welcome to Florida Southern College. The mocks are continuing, and I look forward to staying in touch with you in the weeks ahead as we all prepare to move back to campus. Go Mocks!
And the full plan can be found at www.flsouthern.edu/fscares. A rising number of COVID-19 patient hospitalizations has led the state to deploy its first mobile ICU unit to Polk County. Florida State Emergency Operations Center had a mobile ICU unit delivered to Baycare's Winter Haven Hospital last week. It was put in place and fully equipped over the weekend and was required to pass inspection before it could be used. Winter Haven Hospital has been reporting low hospital bed availability to the state's Agency for Healthcare Administration over the past week. As of Wednesday, only 4 out of 54 ICU beds, or 6.9%, and 6 of the hospital's total 317 beds were available for use with staffing. The 53-foot trailer distributed by Zarity, a South Florida-based company, could provide critical additional space during the pandemic. The mobile unit is capable of providing a similar environment to a hospital's intensive care unit. It offers a negative pressure environment, a feature cited by healthcare providers as helpful in containing the spread of COVID-19. The ventilation system has one HEPA filter that purifies all air entering the unit, while 2 more work to clean all exhaust to provide a safe environment. One treatment that medical professionals use to treat coronavirus is convalescent plasma therapy. However, there's a shortage of plasma for that treatment. Susan Forbes with One Blood talks with Dr. Peter Marks, the director of the Center for Biologics Evaluation and Research with the Food and Drug Administration, about this treatment and the shortage of convalescent plasma.
Thank you, Dr. Marks, for joining us. Right now, we are seeing an increase in many parts of the United States of more people being diagnosed with the coronavirus. And along with that, we're seeing an increase in the need for convalescent plasma. Why is there such a demand right now for convalescent plasma to treat these patients?
It would seem that it's becoming one of the first choices, not necessarily the first choice, but it's become one of the frontline therapies that people look to when people end up in the hospital and start to develop problems breathing. There's probably thousands plus of these units being given each day.
And with the increased usage, is the FDA concerned that the demand could outpace the supply?
We're very concerned at the moment because right now we're on a very steep increase in the number of cases. We were in a problem with supply previously back in April, but now that the number of cases are surging again, we're pretty worried that we're going to get into a problem with supply because the demand is going to increase. We've seen in the past week, we've seen a dramatic increase in demand. We've seen a dramatic increase in the number of hospitals requesting plasma. So we're suspecting that convalescent plasma is going to become in short supply if we don't have more donors come out.
There are some reports out there regarding the need to, for the government wanting to maybe stockpile convalescent plasma. Should we be concerned when we hear something like that, and why would they want to do that?
So the idea there is, while we have people with the antibodies circulating at high levels, to take some of that plasma and put it away for the rainy day when we might need it in the fall. That probably right now is not very realistic because there's not a rainy day in the fall. There's a thunderstorm pouring right now, and we need to use it right now. So right now the focus is we need people to come out and donate because the need keeps escalating right now.
When this first started in April and we were using convalescent plasma became available, you had this image of people who were in critical condition on a ventilator who needed this convalescent plasma as maybe like that last-ditch effort to try to help and save them. But now we're seeing that it's being used earlier on. Why is that?
That preliminary evidence that's waiting to be confirmed by more data, seem to show that the earlier you give the convalescent plasma, the more you help people, the more people you keep off of progressing to ventilators.
And it's hopefully to get them to heal faster and to prevent the use of that ventilator.
One of the main ways it works is by providing those protective antibodies that help clear the virus from the body. So if you clear the virus before the virus has a chance to hurt organs like the kidney or others, the idea is you prevent the damage to their body and people will get better more quickly.
What is your call to action to people who have recovered from the coronavirus to donate their plasma?
This is something that somebody can do who's had coronavirus. People are often very grateful for the care they've received. They want to do something to give back. So if you've had coronavirus and you've gotten better from it, one of the things that you can do, pretty simple, pretty easy to give back, is to go donate convalescent plasma. It's not a difficult thing to do. It makes a big difference. And people on the other end who are receiving it, their lives may be saved.
Polk County is the home of the 8th largest bank in the southeast U.S. now that Center State Bank has completed its merger with South State Bank. The new merged bank will be headquartered in Winter Haven, but the change won't be visible until next year after the banks integrate computer management systems. The South State logo won't replace the Center State one on building signs and the respective websites until then. Currently, a South State customer walking into a Center State office or vice versa could not be served because workers would not have access to that account. Center State and South State announced their merger of equals in January, an all-stock merger valued at more than $3 billion. Both banks held roughly the same amount of assets. The new South Bank has more than 300 branches with more than 1 million customers handling about $26 billion in deposits and $24 billion in loans. Walmart Incorporated said that it will be closing its namesake stores and Sam's Clubs on Thanksgiving Day this year, saying that it wants to have its employees spend time with their families during the coronavirus. The move marks the first major indication of how COVID will affect Black Friday store shopping, which for almost a decade kicked off with big crowds on the turkey feast as well as the following Friday. However, given safety concerns, stores are rethinking their plans for the kickoff. Walmart also said that it will be giving out another round of bonuses for workers on the front lines of the coronavirus. The company said that it will be doling out $300 for full-time hourly workers and $150 for part-time hourly and temporary workers. Drivers, managers, and assistant managers in stores, clubs, distribution centers, and fulfillment centers, and health and wellness will also receive a bonus. It will add up to approximately $428 million. The bonuses will be included in August 20th paychecks for eligible workers employed as of July 31st. Well, thanks for watching PGTV News. The board review is coming up. But first, a couple has to move their wedding plans due to the pandemic, and then they donate their wedding gifts to help out hospital workers. Take a look.
We're on our way to the MMG Hospital to give face mask and PPE to the frontliners.
I call it hashtag wedding with a purpose.
There's an urgency in us that we wanted to get married. I'm not sure if it was triggered by the lockdown or the quarantine.
Not seeing each other.
We're not seeing each other, we're just doing video calls. There's inner realization that we should be married by this time, if not for the coronavirus.
When we look into God's Word, we discover two major things concerning marriage. God is the initiator of the institution of marriage.
With all honesty, it was less worries, less stress.
You may now kiss and embrace your bride, Marlene.
They were able to witness the ceremony through the technology that we have.
And for me, it was perfect. It's a blessing amidst pandemic.
Yeah. Here in the Philippines, there's a lot of appreciation for our frontliners. I just wanted to honor God with our marriage.
We felt so blessed seeing them with their happy faces, their smiles, greeting us happy wedding, and that's a bonus after the wedding. We're just so happy.
I remember a lifetime ago when we started this journey. we were inspired by each other to create something greater than ourselves and achieve so much together. A place to feel alive, to discover who we are, and ensure what always was will always be. Those days when we walked softly and honored our past, when he saved a nation and they saved the world. When he stood for this and she sat for that. When she captured our hearts and he captured our souls. When we were divided.
United 93, do you still hear Cleveland?
And we were united. He lifted our spirits. We aimed higher and never stopped looking up. But along the way, my roads grew old. My bridges shouldered years of weight. My trails became well-traveled. But my roots grow deeper. My branches extend further. I was there for them, and I'll be there for you. Will you be there for me?
Heading off to summer camp? Campers, counselors, and staff, you can become a clean camp champ by following these tips to stay healthy during COVID-19. Start off by being a peer protector. Stay home when you're sick or have been around others who are sick. Then become a germinator terminator by washing your hands with soap and water for 20 seconds. After using the bathroom, after coughing or sneezing, after touching supplies or objects that other people have used, like games, sports equipment, glue, scissors, and other craft supplies, after touching animals or garbage, and before eating. You can also use hand sanitizer with at least 60% alcohol if you can't wash your hands. Next, become a social distancing star by keeping at least 6 feet of space between yourself and others when possible. You might see signs on the wall, tape on the floor, or other items that let you know when and how to keep space between people. Camp counselors can become face-masked marvels by leading the crew and encouraging campers and adults to wear a cloth face covering when it's hard to keep at least 6 feet of space between people. Become a clean camp champ and help make your community a safer, healthier place. For more information on other actions you can take, go to cdc.gov/COVID-19.
Welcome to the Board Review with news about your county government. I'm your host, Tricia Pichette. Today you'll learn about County Commission actions from the July 21st board meeting. The board approved the proposed countywide millage rate for fiscal year 2020 to 2021 at 6.8990 mils, which is 0.2575 mils lower than the current year. Proposed millage rates were also approved for the following municipal service taxing units, or MSTUs. The Parks MSTU was maintained from the current fiscal year at 0.5619 mils. The Library MSTU remained unchanged from the current fiscal year at 0.2109 mils. The Stormwater MSTU was also unchanged from the current fiscal year at 0.1 mils. The Rancho Bonito MSTU also remained unchanged with a rate of 9.1272 set Tuesday. This millage rate is levied on approximately 906 parcels in Rancho Bonito, which is located in northwest Polk. The board also set the tentative budget public hearing for 6 p.m. September 14, 2020 in Polk County's Commission Boardroom at the Neil Cumbie Administration Building, 330 West Church Street in Bartow. The board approved a traffic control agreement on private roads for Hunter Crossing Homeowners Association of Polk County, Inc. The agreement would allow the Polk County Sheriff's Office to patrol the community's private roads for traffic law enforcement. The board approved the release of a warranty and surety in the amount of $62,838.54 in the form of cash surety for Highlands Grace Phase 2. The 2020-2021 fiscal year budgets for the Highland Meadows and Highland Meadows West Community Development Districts were approved by the board Tuesday. The Construction Manager at Risk Guaranteed Maximum Price Addendum with Core Construction Services of Florida was approved Tuesday for the prototype fire station in Kathleen. The cost of the agreement is expected to be nearly $3.2 million. The board approved a piggyback agreement with the Cintas Corporation for uniform services. The services are currently being used by 4 Polk County divisions, and the agreement is expected to cost about $188,000. An infrastructure improvement agreement between Polk County and the Eloise Point Estates Homeowners Association for drainage improvements adjacent to Eloise Loop Road was approved by the board Tuesday. The agreement for the improvements is expected to cost about $118,000. An agreement with Kimley Horn and Associates to provide professional engineering services for the Juanito street lighting design was approved Tuesday. The services agreement is expected to cost about $115,000. The board approved modification number 1 to the consultant services authorization with Hazen and Sawyer PC to provide project management support services for the computerized maintenance management system software request for proposal solicitation, vendor evaluation, and selection. The additional cost is expected to be about $126,116, and the project is not to exceed a total of about $321,000. During the afternoon session, the board held several public hearings on a variety of items. Those items up for consideration included: the board approved a resolution to vacate a portion of platted and maintained right-of-way or easement as shown on the plat of E.D. Greenfield's Michigan Lakeside Park for a road currently known as Edison Road. In a 4-to-1 vote, the board approved the conditional use on a short-term rental home on Lake Eloise near Winter Haven, overturning an initial denial by the Planning Commission. Well, that wraps up this edition of the Board Review. To keep current with programs and progress in the county, visit us online at polk-county.net or follow us on Facebook and Twitter. We encourage you to join us at the next scheduled board meeting at 9 a.m. Tuesday, August 4th, 2020. I'm Tricia Pichette. Thanks for watching.